Okay. Hello, everybody. So this is Dr. Ali coming to you from Precision Chiropractic and the Body Intelligent, part of the Healing Brain series. And today, I'm excited. I have Christy Feiker with me. And Christy is a mother of 4 awesome kids. And she has been in the healthcare field for over 25 years as a licensed midwife and a women's health advocate. Her mission is to empower a healer in every home. And in one way she does this is through working with essential oils through doTERRA. So Christy is my personal essential oil consultant and expert. And I've been working with Christy to find essential oils to help me in my own self-care tool bag for all things body and mind related. And I think she has so much really great information to share. And because of just learning more and more about essential oils, I am wanting to bring you guys, tools and resources to help you find more health and healing, especially at home and through your own means. And I think essential oils are a great tool that you can start to use in order to do this. And part of the Healing Brain series we're going to go into is really talking about how essential oils can help with brain health. A large part of my husband and I's practice, a large percentage of our patients are post-concussion from 1 to 2 weeks after the injury to anywhere from 10 to 20 years after the injury. And these are sometimes mild concussions, sometimes really severe. And there's a lot of different symptoms that can continue to challenge a person with a concussion. And so we're going to go into a lot of those. I'm going to just go through a list of basically common symptoms, and then we're going to detail it out. And Chrissy's really going to go into her go-to oils to help with some of these big symptoms. So in general, a lot of the people that we see have headaches and migraines. There's noise sensitivity, light sensitivity, cognitive problems that involve memory issues and concentration and focus. There's brain and body fatigue. We also see anxiety, depression after the trauma, and then oftentimes sleep disturbances. So those are kind of the whole, there's more to it, but that's a lot of the at least primary symptoms that we see a lot in the office and who we're really trying to help. So I thought we could take it from there and really focus on post-concussion in a general sense, and then talk about headaches, migraines, and then overall central nervous system support.
Okay, awesome. Thank you, Allison. Mm-hmm. Yeah, I feel your passion, and I love that you're able to focus on this specific area because it needs your expertise, and I love that you're offering so many different natural solutions and tools to support the body. And really, the first thing I like to share with talking about essential oils and natural solutions is that, yes, we're going to talk about what to do when symptoms are coming up. But really, if we take a step back, I think this fits in line with chiropractic care and craniosacral and all of the modalities that you offer, is that if we focus on preventative care and wellness, and that our body wants to heal itself. And so we're just giving the body tools to support its own natural healing process. And so we're going to talk about some preventative tools and then what to do as issues are coming up. So there's so many different oils, and really when I'm speaking on oils, I like to simplify it. And so we're going to just focus on a couple oils for brain health to start out, and then I have a couple other areas that doTERRA can support brain health as well. But the first oil that comes up for nervous system in general is balance oil. Balance oil is a grounding blend, and It works on also muscles and bones, emotions, skin, but it is primarily a nervous system oil. I'm going to tell you what all is in balance oil. So it is spruce, whole wood, blue tansy, frankincense, German chamomile, and osmanthus. So frankincense is in there, and that'll be another oil that we'll talk about. But balance oil is amazing for the nervous system. You can use it in many different ways. So diffusing it is one way. I have a diffuser going here. That way you're getting the benefits of the oil continuously. You're not just getting that flash off response that you get with essential oils, where then you want to reapply frequently. When you're diffusing, you're able to continuously get the benefits. So having a diffuser, especially for someone who's had a brain injury and is having difficulty with sleep, diffusing by the bedside would be an amazing tool. Applying balance oil to the bottom of the feet is another great way to use it, especially after someone has just received, say, a craniosacral treatment or an adjustment. It's going to help integrate that adjustment in a way that it's kind of like, here's the old story and the injury. I am aligned now. I'm in this new space, and I'm going to like move forward with it. It helps like move forward. Yeah. And so it's also great on the atlas, top of the spine. So all those different ways, topically and aromatically, would be beneficial for balance oil.
Great.
Yeah.
I use that often.
So good.
Yeah.
Yeah. So the next oil that is just like key for brain health is frankincense. I mean, I have it marked here because I want to read to you some of what is listed in this usage guide for essential oils. So frankincense affects these body systems: nervous system, immune system, skin, and emotional balancing. It's used with brain injuries, coma, concussion, confusion, mental fatigue. The list goes on. Memory.
Sounds like frankincense kind of covers a general umbrella as a go-to, especially for post-concussion.
Yes. And the main thing that I want to point out about frankincense is that before I used doTERRA frankincense, I had never had an experience with real frankincense. It comes from Somalia and Oman. doTERRA does something called co-impact sourcing, which means we have relationships with our harvesters. All other essential oil companies are going through brokers, and almost all other oils, especially frankincense, is adulterated. So you're going to get a lot of synthetics that are actually going to impact the brain in a negative way. And so it's very important that when we're talking about frankincense and the power of frankincense, that we're using pure frankincense. And all essential oils will say pure, but you can go into doTERRA's co-impact sourcing and do some research. And we have listed, you can actually go on the bottom of the bottle, and there is like a VIN number. Mm-hmm. You can type that in on the website, and it will tell you what date and what all the chemical constituents are, what farm it came, you know what I'm saying? Yeah. There's not actually farms for frankincense. They're trees that are passed down from generations, but it will tell you who it came from, what date, how it tested.
Great.
Yeah.
And frankincense. So I know that there's some oils that you can take internally, other ones you just use externally. Is frankincense one where you are able to consume it, or is that one just a external use?
Yes, such a great question. So balance oil is one that's just topical and aromatic. You're not going to be taking that one orally. Frankincense, we encourage oral use. It's amazing orally. So you can do a couple drops under your tongue daily. You can also put it in a soft gel. doTERRA makes it really easy for you to take frankincense on a daily basis orally by adding it to their lifelong vitality supplement. So that's something else that I want to talk about in terms of preventative care to keep from flare-ups happening. If I could just spend a minute on lifelong vitality, because it has frankincense in it, because doTERRA feels so strongly about everyone having frankincense orally on a daily basis for their brain health and their nervous system.
Yeah, and also does, and if you could touch on maybe brain inflammation, if you know that either, you know, with frankincense specifically or with the vitality blend, because brain inflammation could be a huge issue too with concussion. And then that can lead to all other, you know, systemic inflammation as well.
Yeah. So I'll stay with frankincense and talk about all the benefits, and then we'll talk about lifelong vitality, since frankincense is in there. So yes, frankincense is actually nature's greatest anti-inflammatory oil. And so any way that you use it, you're going to get those anti-inflammatory benefits. So like I said, a couple drops on the tongue orally, on the atlas, back of neck, on the crown. I really love frankincense right there on the brain. Bottom of feet, diffusing, wherever you're feeling tension, so temples, and once again, then it's in the lifelong vitality. And in the lifelong vitality, there's 3 goals with that supplement. Basically, it's a three-part supplement. So its goal is to decrease pain, increase energy, and give you better mood. And it is an anti-inflammatory supplement. So it's a multivitamin, right? And we all need proper nutrients to help our body heal itself. And our soil is depleted. So even if we're eating a healthy diet, we're still not getting the nutrients that we had in our soil years ago. So there's micronutrients and whole foods in this vitamin. And then there is a omega that has a high quality fish oil, and then it has 9 different essential oils in there. One of them being frankincense, because it's so important for brain health. Another being peppermint. Peppermint's also really great for oxygenating, for mental clarity. Clove is
that's
in
a
there.
big one with the brain fog, the mental fatigue, focus, concentration, those issues.
Yes. So all of those are in there. So you're not necessarily having to remember, okay, take my frankincense today, put some peppermint on. You're just taking your supplement. So that's in there in the omega blend. And then the third component is a cellular vitality blend. And that blend basically is killing damaged cells and revitalizing healthy cells, right? So after an injury, we're wanting to let go of the damaged cells. Yep.
Free radicals, gotta combat those.
Yes. Yes. And then I have one other category of oils that I'm excited to share with you for brain health, and that is citrus oils. Citrus oils can be used in water, 2 to 3 drops of lemon oil, grapefruit oil. We're actually the only essential oil company in the world that has an essential oil FDA supplement fact on it. And that's how you can know which of our oils you can take orally and which ones you cannot. Like the balance oil doesn't have the supplement fact. So that's a simple user's way to know which ones you can and which ones you can't. When you're taking in the citrus oils, they have a high limonene content, and that supports glutathione, which is a coenzyme, and that supports mental clarity and focus. And it's very hard to take glutathione as a supplement because it's not absorbed well. So it's pretty amazing when you can have that process happen naturally
Yeah,
right?
one of the most important antioxidants out there, glutathione.
Yes.
Yep,
Yes.
great. And with the citrus, I know I take the grapefruit almost every day because it's my favorite. But it does, it energizes, it boosts mood, boosts just spirit in general. That's been my experience. And it's easy to add to just your water every single day and getting that boost. Great. And then how about, what's your go-to for like headaches, migraines?
Yeah. So I find that for head tension and what you just described, people are very specific on what works for them. So there isn't like a one go-to. There is a tension blend called Past Tense that I love. It's a blend that has some frankincense in it, some lavender, some peppermint, some cilantro. Cilantro on an emotional level, it helps you let go of control. So whenever I'm over controlling and stressing myself out, some of that on the back of my neck is very soothing and supports letting go. So that one works amazing for people to apply to wherever they're feeling that tension. Once again, if it's up here or back of the neck. I've seen it in pregnancies where clients previously had to take medication because they would be debilitated from the tension, now unable to take the medication in pregnancy. And this rollerball of past tense blend kept them from going into that place if they used it as soon as they noticed the symptoms coming on.
Yeah.
Other people have specific blends, like just some frankincense and some peppermint together. I've seen other people that just like peppermint, sometimes lavender and frankincense. So that is one of those areas that people are specific on what works for them. So it is, essential oils are similar to food in a way that each body is going to react differently. And so we have to be patient with them and willing to try one thing, see how we feel. They're so safe. They're so effective. There's no harm in trying one and then trying another one.
Yeah. And I think you speak to the concept of one person, a headache is different for 50 people who have a headache, right? And so the reason why a headache basically manifests in one body could be different from every other body that you see, because of, again, life experiences and all of these things that layer in and can contribute. And so I like that also because somebody's tension headaches may be relieved by one oil, and other person's headaches may be more metabolic in nature. And so you would just gear it towards what's really going on, right? Finding the deeper cause. Aiming the tool and the strategy towards that cause, and then so that person can heal whatever's going on for them, not just a headache, right? Headache can have thousands of causes, right? So yeah, great. So wonderful. I think we touched on all of the main points that we wanted to hit on today. Any last thoughts that you have in relationship to essential oils and brain health in general?
I'm just excited. I think that they're amazing, and I've seen huge results, and I would just invite and encourage anyone who's watching this, who may be experiencing anything that we talked about, or if they know somebody that could benefit, to just be open to trying them. I offer free samples. It's really, the oils speak for themselves. And once again, to extend that openness beyond just the first oil, but being open to being patient and trying different ones so that we can, our goal is to help you find what works. We want you to get the greatest benefits from the oils. And so, yeah, to reach out if you would like free samples, because the oils really speak for themselves, and I guide you through how to use them.
Great. Yeah, I one of the things I want to add too is just when you look at all the different ways that the body can heal, and sometimes we have too much of one thing or not enough of another thing. And when you look at brain health, a lot of it is we're looking at the health of the internal system, but then also what are we using as far as products, right, to clean with, to do laundry, all of these things that could actually create toxicity in the body. And the thing that I found too, not just for like mind body healing with essential oils, but also how they can act as a replacement for harmful chemical cleaners, laundry detergent, things of that nature, where if you're absorbing toxicity into your body through those ways, that we need to, that could be causing quite a bit of harm to the cellular makeup of your body, your brain, and to eliminate that, give your body one less thing or multiple things to not have to process and toxify it, then that's another win, right? So I think there's, I like that you can certainly use them for the body and the mind and the emotions and the nerve system. And you can use the same oil you may use for your headaches to replace with a clean laundry detergent and something that's not harmful for your family, So I like the versatility of them and the way that they're able to, you can kind of incorporate them into several aspects of life and not just use them just for the physical or just for this or that. They can become, you get to experiment, you get to play really and see how to, how they can be really fun to use in other areas of your life, in addition to helping your body heal. So that's why I enjoy them as well. Yeah, and baking too.
All of it, right?
Yeah.
Yeah.
All right. So Christy, so people who want to get a hold of you and kind of dig in or dive in deeper to see, is this thing that I have going on with my body something that essential oils could help? Can I use them as, can I put them in my self-care toolbox? How do I incorporate them? What's the best way for them to get a hold of you?
Yeah, so the best way to get a hold of me is through emailing or texting me, because I would like to hear your specific health concern and help get you samples. So like, yes, I have a website and yes, you can go on there and look at everything, but that's not really what this is about. This is about me working one-on-one with you to help you get the greatest benefits. So if you could share later, Allison, my contact information, that would be awesome. You can reach out to me directly.
I'll put that on the comments below the video so that that's attached to it.
Okay, perfect. And then I would love to just close with just a story that is a frankincense story for me. And it was my first personal experience with the power of frankincense. So I was new to my oils, and this was years ago. I was new to my oils, and I'm a licensed midwife, and so I had just come from a very stressful birth. And it was the middle of the night, and I had very young children, and I knew they were going to wake up early. And of course, I was exhausted, and I needed to fall asleep. So that's not a good combination for falling asleep. I felt extreme anxiety, and I tried some lavender, and it didn't stop my racing thoughts and my stress level. And so because I was new, I was still at the level of like looking in my kit and reading what each oil was good for. And so I read frankincense, nervous system, calming for the brain, can help with sleep. And I put some frankincense on my forehead where I felt the tension, and I immediately felt this hug and this just this warmth and this soothing. My brain calmed, my racing thoughts stopped, and it was like in a moment of time. And for me, that was a huge awakening to the power of these oils. And yesterday, I was just brought to a similar place of the heat, and I was doing too much, and I got to a bit of an overwhelmed place and just did some frankincense behind both of my ears. and it just calmed my brain and just brought me back into my body. So just,
Great.
yeah.
Yeah. I know a lot of, again, trauma with the head, and you think how that affects the nervous system, putting it more into fight or flight mode, and the upregulation that happens with the nervous system, that once the gear shifts, it's really hard to downshift basically. And I know that's comes up for our patients often, is once the gear shifts and it goes into upregulation, it's really difficult to actually shift back into, like, put on the brakes, as it were.
Yeah, to have a tool that can do that within a few moments, a few breaths, is powerful.
Yeah. Wonderful. Well, thank you, Christy. This is awesome. Thank you for sharing.
Thank you for inviting me.
Mm-hmm.
All right.
Wonderful. All right. So everybody, if, again, you'll know how to get a hold of Christy if you want to follow up and dive into some essential oils and really go into your particular case and what's going on for you, and seeing how they can help. And Christy's wonderful. I work with her all the time, and it's a pleasure. She really does dial it in to get individual oils for what is going to work for you and what your goals are for your life, really. So I can highly, highly recommend her. And her husband's an upper cervical chiropractor, just like Dr. Andrew. So she's all in with the chiropractic philosophy, and
we are passionate about what you do. So thank you so much for what you represent. Your clinic being the only NUCA upper cervical care center in Vermont is pretty phenomenal. We're really grateful to have you. So thank you.
Good to have it.
All right.
All right. Bye, Christy.
Bye.